Qtern is a medication that combines dapagliflozin and saxagliptin. It is used to help control high blood sugar in people with type 2 diabetes. By controlling high blood sugar, Qtern can help prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. It may also lessen the risk of a heart attack or stroke. Dapagliflozin works by increasing the removal of sugar by your kidneys, while saxagliptin works by increasing levels of natural substances called incretins. Incretins help to control blood sugar by increasing insulin release, especially after a meal, and also decrease the amount of sugar your liver makes. The recommended daily dosage and the optimal time to take this medication may vary depending on your individual health needs, so it's important to consult with your healthcare provider for personalized guidance. Before you start taking Qtern, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning. The manufacturer recommends swallowing the medication whole, but your doctor may have different instructions. Use Qtern regularly to get the most benefit from it, and try to take it at the same time each day to help you remember. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of Qtern may include frequent urination, dizziness, or lightheadedness. If you experience any of these, be sure to speak with your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential side effects. However, it's still important to keep an eye out for any serious side effects and notify your doctor right away if you experience signs of a urinary tract infection, kidney problems, joint pain, unusual skin blisters, signs of heart failure, trouble breathing, or any other concerning symptoms. Qtern can also lead to a yeast infection in the vagina or penis, as well as a rare but serious bacterial infection in the genital/anal area. If you notice any signs of these infections, be sure to contact your doctor immediately. Additionally, while Qtern usually does not cause low blood sugar, it's important to be aware of the symptoms and how to treat it. Keep an eye out for symptoms of low blood sugar, and be sure to speak with your doctor if you notice any changes in your symptoms or if you miss a meal. If you experience symptoms of high blood sugar or dehydration, it's important to speak with your doctor right away. And finally, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of side effects, so if you notice any other unusual effects, be sure to speak with your doctor or pharmacist. Before taking Qtern, make sure to inform your doctor about any allergies you have, especially to dapagliflozin or saxagliptin. Also, let your doctor know about your medical history, including kidney disease, pancreatitis, alcohol use, gallstones, low blood pressure, heart failure, high cholesterol, and yeast infections. When taking Qtern, be aware that it may cause blurred vision, dizziness, or drowsiness due to low or high blood sugar. Avoid activities that require alertness or clear vision until you are sure you can do them safely. Limit alcohol intake while on Qtern to reduce the risk of low blood sugar and high ketone levels. If your body is under stress due to illness or surgery, it may be harder to control your blood sugar while taking Qtern. Be sure to consult your doctor if you experience these conditions, as it may require a change in your treatment plan. Older adults should be cautious of the side effects of Qtern, especially kidney problems, dehydration, dizziness, and low blood pressure. If you are pregnant or breastfeeding, discuss the risks and benefits of taking Qtern with your doctor. When taking Qtern, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. Certain medications, such as azole antifungals and HIV protease inhibitors, may affect how saxagliptin, a component of Qtern, works in your body. Additionally, beta-blocker medications may prevent the fast or pounding heartbeat that is usually a sign of low blood sugar. It's important to be aware of how other medications could affect your blood sugar levels and discuss this with your doctor. Before starting, stopping, or changing any medication, it's important to talk with your doctor or pharmacist about how it may affect your blood sugar. Regularly monitor your blood sugar levels and report any symptoms of high or low blood sugar to your doctor. It's also important to inform lab personnel and your doctors that you are taking Qtern, as it may interfere with certain lab tests, potentially causing false results. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the US, you can dial 1-800-222-1222 to reach your local poison control center, while Canada residents can contact a provincial poison control center. It's important not to share Qtern with anyone else. Make sure to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. Learn the symptoms of high and low blood sugar, and how to treat low blood sugar. Check your blood sugar regularly as directed. You may also need to undergo lab and/or medical tests while taking Qtern, such as tests for kidney function, blood pressure, blood sugar, hemoglobin A1c, cholesterol, and ketones. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Qtern, take it as soon as you remember. But if it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Remember to store Qtern at room temperature, away from light and moisture. It's important to keep it in a safe place away from children and pets. When you no longer need it or it has expired, make sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And as always, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.